Welcome back to Finweek Money Matters. While a significant number of people in South Africa are on a medical scheme, few of us really understand the products that we're on and whether it's the best option for our needs. Research from Healthbridge, a company dedicated to transforming the healthcare business, found that the medical savings start running out by May. By December, about 60% of claims are not covered by medical aids. Joining us now in studio to tell us how to choose the best medical aid option for you is Luis da Silva, Managing Director at Healthbridge. Finweek editor Jana Marais is still with us, and Barry Rykaart, Independent Healthcare Consultant at CureMED, joins us from our Cape Town Bureau. Ladies and gentlemen, thank you so much for joining us today. Luis, maybe if we can get more perspective from you, especially on the savings numbers when it comes to the quote that we've just read out. You know, how dire is the situation, and are consumers aware that there's a lack or a shortfall when it comes to their savings overall?
Yeah, it's quite interesting. We primarily help doctors with the business side of their practice. And last year alone, for example, we sent 40 million bills or claims from doctors to medical aids. And so what we see over the year, over the calendar years, are some very interesting trends. Januaries are very busy, and we suspect largely because some people who ran out of benefits in the previous year are waiting for the benefits to open up so that they can get the treatment they need. Easter is a very quiet period. We don't tend to get that sick when we're on holiday. And then the months of June and July really pick up. And of course, with the flus and everything, you can understand that. And from there on, the real drop-off starts kicking in to, as you pointed out, by December, medical aids are paying doctors about 60% of what they paid in the month of January. The reality is that we see that drop-off happening earlier and earlier every year, obviously as benefits are getting tighter. Largely driven by members buying options that are actually cheaper because of the affordability thing. And at the same time, the stress on medical aids is increasing as our disease burden increases in the country. So those forces coming together result in people running out of benefits quicker year on year, as we've seen over the last couple of years.
Barry, let's come to you to get more perspective on this, especially when it comes to the selection of medical aids for consumers. Is there enough awareness out there? And number two, how much of this awareness actually relies on those who are selling the products and interacting with the clients face to face?
Thank you for having me. Well, I would say from the awareness point of view, we do find that there is a lack of knowledge with the type of products that's available within the industry, and it does have a direct impact on the option choices that the consumers make.
Just on that, maybe if you could walk us further on that, where are we falling short? And number two, does the consumer also need to have their own creation of awareness to be established?
Well, I think, you know, where it comes down to educating yourself towards your product range. We've just mentioned previously with products that have savings facilities that most of the market is making use of, the savings accounts being depleted by the end of the year. Also, for the consumers to know that there is different designs of products out there. You know, if you will allow me to take it further, we're currently sitting with 23 open medical aid schemes in the market, each with an average of around 6 options, which leaves you about a choice of about 138 options to choose from. But not all these options are developed and designed exactly the same. So it is important for the consumer to understand in the beginning is what type of design they're dealing with, because you'll find products. If you just want to break it up into categories, you find traditional options, which is more a structured-based product. Then you'll find new generation products, which is most familiar in the market, which is a hospital savings account concept. And then you'll find more capitated products, which is products that's built from a cost building saving perspective. And then you'll find the most recent ones, which is more a hybrid type of product, which is a combination between traditional and a new generation savings options. Normally that is where the client or the consumer needs to start and actually understand the design of the product before they actually take it further to say, how am I going to accompany my needs and my requirements and as well as my objectives, and how do I actually manage that onto the design of product of my choice.
Jana's going to come in with a question here, obviously, to get some further insights.
Gugu, I think one of the things that was interesting for me from the stories that we're running in the latest issue is there's kind of a checklist. You know, you have to look at, you know, is it a credible medical aid? And I suspect if you look at the big names like Discovery, I don't think many of us worry that it's going to go bust. But actually, one of the interesting things for me was, you know, I don't think any consumer is going to go and sit and really compare all the options we have. And somebody mentioned, you know, you should actually just have a chat with the secretary or the receptionist at your doctor's offices next time you go to the GP and ask them, you know, which medical aids you struggle with to get your money back.
Sure.
And actually, interestingly, I had this chat with my dentist, and I asked her, because I always feel my dentistry coverage is quite bad. And she said to me, you know, oh, you should look at this and this and this option. It's a 3-minute chat, and, you know, in future, I will definitely keep that in mind. So I don't know if Barry might want to chat a bit about, you know, picking an independent broker and maybe looking at a bit broader than just sitting with your financial planner or your broker to discuss the options that are available to you.
Exactly. Barry, we'll come to you in a moment. Louis, you wanted to come in on this part of the conversation?
Yes, I want to pick up on what Jana just said. Another interesting thing to talk to your doctor about is what kind of relationship do they have with the different medical aids?
Yeah.
Because sometimes there are specific contracts and agreements that your doctor has with a specific medical aid. In some cases, even when you have no savings, they will still pick up 1 or 2 or 3 or 4 kind of treatments or visits, even though you are a medical aid. So those are also important things to know. If you particularly have a family doctor that you work with, that you go to and your family goes to, what kind of arrangements do they have with those medical aids?
Barry, let's bring your voice into the conversation, a follow-up on what Louis and both Jana have said, the relationship between your healthcare provider and the medical aid operators in the market.
Well, I think also at this point in time, if you look at the developments within the medical aid industry, we find that we have providers, health providers, and the fees and costs are quite high. And this is also a contributing factor towards people using up their savings facilities. But we do see in the industry today that the schemes are doing something about it. And just to link up to Louis is that what schemes are doing is they are signing up a preferred provider lists or contract with doctors to charge a agreed fee. And most of these lists are available freely on the web, where the consumers can actually find providers that are or have been prepared to decrease their fees to a scheme tariff rate.
Louis, I want to come to you and get perspective on again, the management of your health medical aid. Obviously, people's family structures change. Some people get married or divorced, their children and further dependents who come on. How important is that for South African consumers to be aware of, and do these medical aid companies also provide some kind of assistance and guidelines as to how to do it efficiently?
I think it's a great question. I think once you know the structure of your medical aid and how it's designed, and sometimes you don't have a choice because your employer actually chooses for you, you might have a few plans or options you can choose from. But then you have to think of it like a budget, much like our household budget. And you need to understand the different pockets inside the budgets. As you pointed out, Jana, sometimes there's a cap on dentistry, sometimes there's a cap on physiotherapy, so on and so forth. And then, like any tough budget, we have to make choices. If my 3-year-old child has got a sniffy nose, do I really need to go to the ped? Or do I go to the GP? Because the prices are going to be very different. There are options of whether you have ethical drugs or the generic types. Under certain conditions, that helps you manage your budget and your cost. So it's really, I think, a case of you as a consumer, your doctor, and the medical aid working together as a team and not against each other.
Jana, you've got some perspective here?
If I can jump in there just on budgets, I'm obviously one of those people who fall for the rewards program because of the gym discount, and then I never go to the gym anyway. But at what point should you consider the rewards programs, and at what point are they actually worth it? Yeah.
So I can speak for myself. I certainly don't want to lose my gym contract and my discounted flights and so on. But on the flip side, there's very good reason why these rewards systems have been put together. It's been proven over and over by some of these medical aids schemes that by incentivizing us to make healthy choices, be it going to gym or eating the right foods or so on, in the end, the actual cost of healthcare drops. And that's what we all want kind of together, is that the cost of healthcare drops, because in the end, our contributions will be less next year, and there'll be more available for us to spend. And that's the other side of the rewards program. There's a science behind it as to why they've been brought about.
Science behind incentives, hey, which many consumers are piggybacking off of. Well, unfortunately, that's where we have to leave the conversation for today. A big thank you to our panelists today, Luis da Silva, Managing Director at Healthbridge, Finweek Editor Jana Marais, and Barry Rykaart, Independent Healthcare Consultant at CureMED, joining us from our Cape Town Bureau.